Yes, friends, very good morning again. Welcome back. Today we will discuss in brief about a very important therapeutic segment, that is diabetes. Diabetes has been prescribed in old manuscripts, textbooks. Diabetes basically, is a lifestyle disease. It is not gifted by God. Due to change in our lifestyle, this disease is on increase, on rise, and India has become like diabetic capital of the world. Of course, Europe, US, all over world incidence of diabetes are increasing. So let us know what is diabetes, why this happens, how to know, and what are the treatment modalities we will discuss. So the word, diabetes means uh, when somebody drinks too much water and also goes for pissing too frequently. That is polydipsia, too much thirst, and polyuria. This is one signal of diabetes. When somebody is always drinking water, thirsty, going to sir, that means something may be the diabetes. And when diabetes is not controlled and when glucose level is too high in the blood, then this starts excreted out with urine also. So the urine also, will become sweet because of glucose. So when he urinates at the place, the ants will come. So in olden time, the Vaidya and the old doctors, how they will diagnose diabetes, they will see when you urinate, nearby are ants coming. So when ants they come, that means the urine is sweet. Anyhow, that is the history. So diabetes as such, is a lifestyle disease. To know in diabetes, we have to know that when we eat any food, the food stuff will be converted into the smallest unit. So the polysaccharides, complex sugar, will be converted into glucose. So this glucose goes into the blood. Now when glucose goes into the blood, now a hormone will come, that is insulin. So insulin will help this blood glucose enter the cell. So it is cell entry or gating. So glucose will enter the cell, and also glucose will be converted into again complex, that is glycogen. So this is function of glucose. So when you are eating food, glucose is increasing in blood, and remember the blood in glucose is of no use. It cannot be used. It has to enter the cell for metabolism. So blood may have 300, 400, 200, any amount of glucose, gram per liter, but this body cannot use. So the glucose has to enter the cell. So insulin does it. Now when glucose level falls down below a level, normal level, now another hormone will come, that is glucagon. So glucagon now will convert glycogen, complex sugar, into glucose. So again glucose reappears. So this is the hemostatic mechanism which is going on. That glucose is converted into glycogen and glycogen is converted into glucose. Normal, it is in balanced, but there is imbalance in this metabolism. So either due to fasting and feasting, both are bad. When you eat too much glucose level is high, and you need more insulin to convert glucose into glycogen, and for entry into the cell you need more insulin, and slowly your insulin requirement is too high, and later on now insulin, in spite of insulin present in blood, it may not work. That is what is insulin resistance. Okay, so and also reverse, you are not eating, you are fasting too much, glucose goes down. Now your glucagon is converting in glycogen into glucose every time. So again now glucagon will say hell with you. You are not eating, fasting 2 days, 3 days like this long. So again there will be adverse metabolic problem. So friends, if you eat balanced diet in the right way at the right time, the chances of developing diabetes are minimum. That is why when we come to the treatment, the first treatment of glucose diabetes is non-pharmacological treatment. Without drug, you can treat diabetes if patient is at the borderline by change in the diet habit, eating more salad, less of carbohydrate, okay, a balanced diet if he eats at the right time. This will help. You do exercise, you burn glucose, you do meditation, you do yoga, you are in a relaxed mood, okay, and you are living a healthy life. So this helps diabetes control. And parallel to diabetes is also blood pressure, hypertension. Generally they are cousins. So whenever there is diabetes, also there are chances for hypertension. Why? Because diabetes, anyhow, complication we'll discuss later on. So this is what is diabetes. Okay. So this is lifestyle disease. Diagnosis is very simple. There is one old, oral glucose tolerance test, OGTT. They give 75 gram or 100 gram of pure glucose, and they check your blood glucose after 2 hours, and they will tell you have this. And more reliable, another now test, what is happening is hemoglobin glycosylation, HbA1 or HbA1c. That is amount of the glucose attached with the RBCs in the hemoglobin. So that tells you that the history and confirm about the diabetes. Another thing, in diabetic patients generally feel not only thirst and polyuria but also weakness, because they have more glucose in the blood, and this glucose present in blood they cannot use, so they feel weakness mostly. And also insulin, either there is less insulin, or there is, in spite of insulin, there is a resistance to insulin, so insulin is not entering the cell, and so the metabolism is affected. So less metabolism, they feel weakness. Generally many people feel weakness even without diabetes also, so don't misunderstand. But yes, weakness is one of the factor in diabetes. So this is how you can diagnose diabetes. Okay. Now there are different type of diabetes. One which you should know, very important, doctor should remove the chances, that is diabetes insipidus. This diabetes is due to lack of ADH, antidiuretic hormone. So this less of ADH, then there will be frequent urination. So, okay, so it is not related to glucose metabolism, remember. So such cases are diabetes insipidus, I think around 5 to 10%, or around 5% may have. But here the beauty is, you by giving the hormone ADH, you can give permanent cure to the disease. Okay, so diabetes insipidus. And what is mostly 90% or 90% patients they suffer from is diabetic mellitus, where there is a direct abnormality with the glucose metabolism. So diabetic mellitus, now why it is there? So again classification, one due to insulin, lack of insulin, or there is no insulin. Okay, so that is insulin dependent diabetic mellitus, IDDM. Generally it is in a children or young adult, because here reason is insulin, only lack of insulin. So treatment will be insulin injection. You have to take intradermal and injections and different routes, intradermal. Okay, so this is due to insulin dependent. Again, here percentage are less, maybe out of 80% total diabetic mellitus, around 10% is insulin dependent diabetic mellitus. And mostly again 80%, 70-80% is non-insulin dependent diabetic mellitus, that is NIDDM, where they are not dependent on insulin, but either there is lack of insulin, insulin resistance, or due to other factors, there is a more glucose in the blood, and these patients are obese because of obesity. Okay, that and the factors like that. So these are two types of diabetic mellitus. Right now, before treatment, Diabetic complications. Diabetes is a very dangerous disease, if you ask me, because it has so many collateral damage. Nobody will die of diabetes as such, per se diabetes, but complications. One is the diabetes or hyperglycemia. Too much glucose into the blood. Normal value, is fasting 70 to 110 gram per, and postprandial or after food, it should be 110 to 140 or maybe 150, something like that. It depends on the individual, but some people up to 160 also may be normal, or they are the labile at the borderline. So up to a percentage, say 140 to 160 is 80, doctor may say don't take treatment, modify your lifestyle, and diabetes can be treated. Okay, so when there is more glucose into the blood for long time, remember, this causes so many complications. That is something very important for you to know. So what this happens? One is, because of more blood glucose into the blood, now there is a plaque formation. And with this glucose, now there are lipids also. Generally, when you are obese, your VLDL level or your triglycerides are adverse. So the very low density lipoprotein VLDL also they comes and they accumulate here. Later on, calcium also comes and gets accumulated. So the blood supply to the arteries is reduced, and that causes abnormality into the artery. We call as angiopathy. Angio means artery, and pathy means abnormality. Angiopathy. So arteries now, the endothelium inside lumen of arteries undergo change everywhere, all over body. And arteries, what are arteries? They carry blood from heart to the organs. When the blood supply to the organ is reduced, all physiological function will be reduced. So this angiopathy now is microangiopathy. Arterioles, smaller arterioles, arteries will be affected all over body, but some place the changes are very seen and more. For example, take eye. In eye, this is one artery, remember. Optic artery is one which doctor can directly see. Otherwise, no artery is visible up from outside. Veins you can see, but only optic artery. Okay, and one time the treatment, the diagnosis of hypertension was looking at the eye. Doctor will still, they do eye examination. So the optic artery will go under change. So there is a optic diabetic retinopathy. The arteries will go under change, and even later on the visual may be affected. One can be blind. And if there is hypertension, now there is hypertensive retinopathy. So there is more pressure, more glucose in the blood, and arteries will undergo change. There will be bursting of arterioles, and one can be blind. Very dangerous. So eye is one. Second, kidney. All nephron undergo change because of high glucose. So nephropathy, renal diseases are common in diabetic if unchecked. And next is the brain. Brain will also, all artery, brain consumes lot of oxygen and that. So brain will be under arterioles, and arteries in brain will go under change. There can be stroke due to some internal busting, or blood supply is reduced. There can be transient ischemic attack in the brain. So brain, okay. And very important, friends, is the coronary artery. Coronary, you remember we have discussed that coronary is the one artery. Now this is your heart, all four chambers of the heart. Okay. Now all four chambers are full of blood, but the blood supply to heart is by this only one, that is coronary artery. So there are two coronary. This is aorta. There are two coronary artery, left and right coronary artery. So a coronary filling the blood which entered to coronary, and that is responsible for blood supply to the heart. Remember, heart is full of blood, but it cannot use its own blood. The blood has to enter coronary artery. So in diabetic patients, because of atherosclerotic changes, the coronary artery also there is a blockade. Atheroma. Oma means tumor. And so atheroma. So the lumen will be reduced. So coronary artery blood supply is reduced. and that causes lot of problem, friends. Coronary artery. Okay, so these are organs. Peripheral vasculature will be affected. Huh? The supply to the peripheral will increase. Diabetic septic foot is very problematic, because if there is any injury to anywhere, the healing will be delayed, because enough blood is not reaching. Okay, and then the high glucose in blood becomes a media for organism to grow, for microorganisms to grow. So infection, skin infections is also suffered more by diabetic patients. Is diabetic septic foot, sometimes amputation and all, very difficult unchecked diabetes, friends. So skin infection, fungal skin infections, so because blood supply is reduced, and also there are organs, where you need very good supply for functioning. If those area blood is not entering, the organ will not work. So erectile dysfunction is also more in diabetic patients, because of lack of blood supply. Because blood means life. Any part of your body, if blood supply is reduced, that organ effect will be compromised. So these are complications of diabetic patient, plus many more, gentlemen. So this is diabetes. Now, what is the treatment? The first treatment is the non-pharmacological treatment. Best is without drugs. If you can treat a patient, that should be our objective. So lifestyle modification, exercise, yoga, eating balanced diet, eating right food, and not taking something which causes high level of glucose suddenly. Those things should be avoided. So non-pharmacological. Now comes to pharmacological. So there are two type of drugs, One drug which directly causes hypoglycemia. They reduce the blood glucose directly. Hypoglycemic agent. Second class, they are anti-hyperglycemic. They don't allow glucose level to go above a normal level. So there are hypoglycemic drugs like, for example, sulfonylureas. Glibenclamide, Dionil, you have heard the name glibenclamide, a very old drug used in more than 50-40 years. First sulfonylurea discovered, glibenclamide, and then many derivatives gave gliclazide, glimepiride. Today this is one of the most popular drug used, glimepiride. So these are hypoglycemic agent. Okay, they directly reduce glucose. The second class of drug, they are anti-hyperglycemic. They don't allow glucose level to go above a particular level. So these are like biguanides, like metformin, one of the most popular drug used. And now there are more indications also, like they are used in polycystic ovarian disease, and other indications have come. But metformin, the gold standard treatment, And then combinations, both. Remember, combinations are better because you give less dose of one drug or two drug. Both less drug means side effect will be less, and there will be additive actions. Plus there are other drugs, not anti-diabetic, but to reduce this LDL, to reduce more cholesterol, or to increase good cholesterol. So there are other class of drugs also used. Then there are glitazones, pioglitazones, acarbose, or many drugs. But basically these two class of drugs are used in diabetic patients. So gentlemen, as a medical rep, focus on this therapy, because these are chronic segment. Once a doctor uses your product, he will use lifelong. You remember in glaucoma we have discussed. So diabetes is a very good segment in the way that you have a chronic segment. Once you create a prescription, once you have a business, you will have lifelong. So learn more and more. You can read our book also. Me and my friend Mr. Daniel, we have written that book for medical reps. More information is given in the book, or through internet. Through that, read slowly and slowly. But diabetes is very interesting disease, and you as a medical rep, because you are walking every time, I am sure 99% medical rep don't have diabetes, because they do lot of physical activity. Okay, don't use lift in hospital, go by staircase. Okay, and when you are doing more physical activity, you are generally healthy. So wish you a good health. All the best. Thank you.